This is the PPE video. So you're gonna start by washing your hands, and then you will start putting on the PPE. So you want to start with the gown. You want to tie it. And then you want to make sure that you fold it over to cover the back. You will then apply the mask. You want to pinch at the nose. You will then put on the eyewear. I don't have any eyewear with me, but it would go on next. Then you put the gloves on. You would pull them over the cuffs. So then you would enter the patient's room and you would do CJ wiper, or before you enter the room, you would check documentation, unless there's a computer in the room. But you would do the documentation. Then you would, when you go in the patient's room, you would provide privacy. You would identify yourself, identify the patient using 2 patient identifiers. You would explain the procedure, explain why you're wearing PPE, explaining, we just want to prevent the spread of any infection. And if they're confused about what sort of infection they have, you can give them more information about that. And then you would do the normal, raise the bed, and carry out the procedure. So then for removing the PPE after you're done, so you would then do your exit procedures, lower the bed, make sure the patient has their call light, see if the patient needs anything else, and then you would wait to document until you left the room. But you would exit the room and you would start by taking off the gloves, folding them out. Putting them in the appropriate receptacle. Take off the eyewear, touching behind the earpiece behind the ears, taking them off, putting them, or you threw the gloves away, put this in the receptacle. Taking off the gown. So you would untie it. Under the sleeve, pulling down with this sleeve, leaning forward a little bit and kind of rolling it so that you can grab the clean side and the dirty all goes in, putting that in the appropriate receptacle. And then you would take off the mask, again, touching behind the ears, pulling it off, and putting it in the appropriate receptacle. So then you would wash your hands, hand hygiene, and then you would go document.